Welcome to Take Control of Your Health. Chronic diseases are now the leading cause of disability and death in the United States. More than 1.7 million Americans die of chronic disease each year. 80% of older adults have at least one chronic condition, and 50% have two or more. 95% of our healthcare costs are used on older adults with chronic conditions. Heart disease, cancer, diabetes, and stroke are the cause of almost 2/3 of all deaths each year. As we begin to live longer, chronic disease began to replace the acute illnesses as the nation's main health challenge. The U.S. healthcare system is still largely designed to treat patients with acute medical problems. Acute conditions, an example would be appendicitis. It's of short duration. It can be accurately diagnosed with decisive tests. It's curable with surgery, and your health professional tells you what to do and you follow the directions. A chronic condition would be, for an example, heart condition. This is ongoing. It's hard to diagnose, and sometimes many tests are needed in order to diagnose the problem. It's going to be with us for a lifetime, and we need to be partners with our healthcare provider. Oftentimes, when we have a chronic condition, we believe that the disease is the problem, and what we feel is out of control of our lives. This symptom cycle that you see shows that they're interrelated symptoms. For example, the disease causes tense muscles. The tense muscles may cause pain. The pain may cause you stress, and the stress, as a result, may cause fatigue. The course wants to teach you techniques and skills that helps you to develop the way of breaking this symptom cycle at any one of these points. And when you do that, it helps you to manage the chronic condition. Physical symptoms aren't the only challenge. Overcoming the fear of the unknown, the fear of the future, fighting depression because you're not able to do the things that you used to be able to do, avoiding isolation. Oftentimes we back off from our family and from our friends when we're not feeling well. It's also difficult to change our diet and also to keep up our physical activity. The National Council on Aging found that 30% of the people with one or more chronic illnesses are living in pain. 65% are stressed and 50% are depressed. This cartoon shows how probably many of us are feeling at this stage in our life. Honest doc, if I had known I was going to live this long, I would have taken better care of myself. The good news is it's never too late to begin. So much of what we do is mopping the floor instead of turning off the faucet. What if you knew that there were tools and resources that you could use that would improve the quality of your life? Lifestyle changes certainly can help. If you stop smoking and you use better breathing techniques, you're going to have healthier lungs. Exercise can certainly increase bone density, reduce falls, and maintain your weight. Healthy eating can lower blood pressure, cholesterol level, and control diabetes. The goal of Take Control of Your Health workshop is to prevent your illness from defining your life. A chronic condition is one that's going to be with us for a lifetime. It's not going to be cured, and it needs to be managed by the way that you lead your life so that you can have an active, fulfilling life. Nutrition, exercise, the way you think can help you to manage your disease. Take Control of Your Health workshops are evidence-based workshops that has been created by Stanford University. They're led by trained individuals who also have chronic disease. And the support of the other members of the group is what really helps you to manage your life. The philosophy of the program is that people with chronic conditions have similar concerns. They're dealing not only with the condition of their illness, but also with the impact that that condition has on their lives and on their emotions. Individuals with chronic conditions can teach the workshop as effectively, if not more effectively, than healthcare professionals. The workshop provides knowledge and skills for individuals to take a more active role in their own health. The workshop is limited to 15 participants so that there's a lot of interaction and a lot of sharing that goes on during the workshops. The sessions are 2.5 hours long. They are free of charge, and everyone receives this book called Living a Healthy Life with Chronic Conditions, and this is chock full of information. Refreshments are served at each meeting. You don't use a screwdriver for every job. Sometimes you need a hammer or a drill. The same is true when you have a chronic condition. And we have what we call a self-management toolbox. And this, you can choose the activities or the techniques that work well for you. Physical activity, use of medications, managing your fatigue, planning, better breathing, working with your healthcare provider, and learning communication skills of how to share your needs with your family and your physician. Problem solving, using your mind, and healthy eating are all tools that you can choose from. Using the power of your mind to help your symptoms. Breathing techniques, prayer, meditation, guided imagery, relaxation, and distraction are all ways that we can help to relieve the stress and the pain of the condition. The process of the program is every bit as important as the information given. We do a lot of goal setting, which we're talking a little later about action planning, brainstorming, where we elicit all of the wisdom from the members of the group. Group problem solving with individual decision making is important. And helping others helps us to help ourselves. So there's a lot of feedback, there's a lot of sharing, and also modeling what has worked for others can help us to learn what to do for ourselves. The steps that we use in problem solving are, first of all, to identify what the problem is. Then we elicit suggestions from the group as to what ideas you could use to solve that problem. You select one and see how that works, and then the process starts over again. A very important aspect of this workshop is to create an action plan. And this action plan each week is a goal that you set that is something that you want to do and you want to achieve. It has to be something that you can achieve. You want to set your goal to a point that is achievable. And it should be action specific. That means that you answer the questions, what are you going to do? How often are you going to do it? When are you going to do it? And how much of this activity are you going to do? We want each of you to have a confidence level of 7 on a scale of 1 to 10 so that you know it's something that you can do. This cartoon again says it all. What fits your busy schedule? Exercising 1 hour a day or being dead 24 hours? The people who have taken the program, Stanford University has done an extensive research and followed up on the participants for 2 years after taking the workshop. The participants have reported that they believe that their health has been improved, that they're less limited in their daily activities, that they're less bothered by their illness, and they have greater confidence in their ability to manage their conditions. On a local level, our participants have said that this course provided the tools I needed to better manage my life with a chronic disease. I've learned to set goals, to make an action plan, and to help me achieve my goals. To live well with a chronic illness, then, is largely a mind game. Think about who you are and what you want with your life. How will you make the most out of your life now? Do not stifle your dreams. And that was said by Richard Cohen. This workshop is sponsored by Community Services, Inc. of Ocean County, the Office of Senior Services, and the Ocean County Health Department. I'm Lou Ann Kane, and I can be reached at 732-281-8391 or on the website at yourhealthhowto.org. Thank you.